Many brilliant advances have happened because someone was brave enough or desperate enough to take a risk. A bold idea may take years to research and develop, but the payoff can be enormous. Nowhere is this more evident than in the field of healthcare.
At no other time in medical history has the term marvel of modern medicine been more applicable than it is today. Through robotics, microbiology, and nanotechnology, our ability to repair and even improve the human body is greater now than many of us just 10 years ago could imagine. However, even with all the modern medical marvels out there, there's one life-changing procedure being successfully administered that has not changed much for more than 100 years.
Cornea transplantation is probably the oldest transplant currently being performed in the United States. In fact, the first cornea transplant occurred in 1905 in what is now European Czechoslovakia. So we've been doing this for over 100 years. The first eye bank in the United States was established in 1944 in New York City, the Eye Bank for Sight Restoration. However, the North Carolina Eye Bank this year celebrated its 60th anniversary, 60 years of giving the gift of sight to North Carolinians and people around the world.
For thousands of Americans across the nation that experience the medical miracle of restored sight via a corneal transplant, it all begins with the tissue donor and the eye banks, such as North Carolina Eye Bank, that recover, evaluate, and distribute the life-changing tissue.
The North Carolina Eye Bank is a nonprofit organization dedicated to restoring sight worldwide. The mission is to recover, distribute ocular tissue for the restoration of sight. And what that means is, after death, we contact the families to discuss the donation opportunities. We recover the corneas and then evaluate them to make sure that they're safe and won't cause harm to the recipients.
Eye banks have successfully met the U.S. need for corneal and sclera tissue for several years now, to the point that there are presently no patient waiting lists. Fortunately, thanks to the caring Americans that agreed to donate their eyes so that others might see, surgeons only need request the tissue once a surgery date has been scheduled. Each year in the United States, more than 50,000 people have their sight restored through cornea transplantation, and hundreds of thousands are helped through the important research to find cures for other blinding diseases. Each year, the North Carolina Eye Bank provides corneas for over 3,000 transplants, with additional tissue being provided for research and training. Over 90% of all corneal transplant operations successfully restore the recipient's vision.
When I was about 18, I noticed that my eyesight was deteriorating, and at that time I was diagnosed with a condition called keratoconus, which means that my corneas were cone-shaped instead of a normal smooth curve. I'm the typical physician patient. I waited too long, probably a couple of years longer than I needed to, and ultimately had my left eye done. Then about 10 months later, I had my right eye done. I had bilateral corneal transplants. And as a result of those transplants, I've been able to continue doing what I love to do, which is liver, kidney, and pancreas transplantation. Because two families said yes to corneal donation, all of my patients get their transplants, and I get to continue doing hundreds of transplants a year and hopefully benefiting people and saving lives.
The splendor of the rising sun, the color, diversity, and awe-inspiring wonder of creation, the beauty of a loved one, and the smile of a child. Of the 5 precious senses we were designed with, most of us would agree there is none more precious than the gift of sight. When it comes to restoring sight to those who have lost it due to cornea disease or damage, it's eye banks such as the North Carolina Eye Bank in Winston-Salem that's been helping doctors provide miracles in sight for more than 60 years.
Sonia died in an auto accident on her way to school. It was about 7:30 in the morning, and the troopers came to my office about 1:30 that day. I had to identify her as my child. That is the hardest thing I've ever done, and it's the hardest thing I will ever do. To look at this man and to see my daughter literally through his eyes, it's a blessing.
To learn more or contact the North Carolina Eye Bank, visit them online at www.ncibank.org. or call them at 1-800-552-9956.